All right, Dr. Rollins joining us here for another segment to drop some knowledge on us today.
Yeah, thank you.
Today we're talking about adrenal fatigue.
Adrenal fatigue.
What does that mean?
Well, first of all, adrenal fatigue, probably a good portion, maybe half of the people watching today have some degree of adrenal fatigue. Okay. It is very common. The adrenal gland sits on top of the kidney and it makes our stress hormone, one of them called cortisol. And cortisol is what helps us fight the saber-toothed tiger, so to speak. It works with adrenaline and it helps maintain our blood pressure and our blood sugar and fight inflammation. It does some good normal things. The problem is in the modern world today that we're not fighting saber-toothed tigers and then recovering. Right. We're sort of running from imaginary bears and tigers every day.
Sure.
And there's a lot of reasons that people can overdo their stress response and begin to tax it to the point that it begins to fatigue and burn out, and that's what we call adrenal fatigue. But it's more complicated than that. It's really some dysfunction in that stress response. And so we treat a ton of this. It's so common, and I'm doing a seminar next Monday night at the center, so I wanted to talk about it today. If you have symptoms of fatigue, it's hard to get going in the morning. Maybe you get a second wind midday. By afternoon, you're crashing.
Yeah.
You know, maybe after dinner, you get another second wind. And then in the evening, wired but tired is a common thing where people are exhausted, but their mind, they can't fall asleep because their mind's just racing. That's classic for adrenal fatigue or dysfunction. If you're prone to low blood sugar without eating frequently, prone to get lightheaded, maybe emotionally feel kind of like a hot reactor. If you have a stressful day, it just wipes you out.
Yeah.
Another thing, people that exercise hard, that can kind of wipe them out. If any of that resonates with you, you know, those may be symptoms of adrenal fatigue. And it's a fairly easy thing to test for, and it's a little more complicated to treat, but with natural treatments, we sometimes look at behavioral things, or we'll use vitamin therapies or glandular therapies or herbal things to help support the adrenal. But we usually help people with adrenal fatigue, but it's very common. You'll see people go through life maybe through their 30s and 40s, they've got kids, they're not eating well, they're stressed at work, etc. And then finally something just tips them over and they crash. That's a pretty common scenario.
Okay, so you mentioned you can take some herbs and vitamins and whatnot to possibly fight that. Is there maybe some sort of way to fight your routine to fight this fatigue that
one of the things that I do, I hardly treat it without having people read more on it. I steer them to a book called Adrenal Fatigue by Dr. James Wilson. It's kind of a classic written more for patients, because I want them to understand that things like diet, sleep, relationships, all sorts of things can factor into stressing the adrenal. A lot of times what we find are other hormone imbalances or digestive disorders, food allergies, things like that that have been driving some of this for years. So it's our job to kind of tease all that out. Again, the seminar is next Monday night at the Integrative Medicine Center. It's a free seminar on adrenal fatigue. We do seminars every week, and you can see the information on the screen there. If you can RSVP, that'd be great. Thanks.
All right. Thank you so much, Dr. Rollins, for all of that. And for more information on that, like you said, go ahead and visit his seminar on this upcoming Monday.